Joining me in studio is Dr. Clayton Koganow. He's a naturopathic doctor in Lethbridge with Meridian Integrated Health and Wellness Center. He's also done some training in conventional medicine and has a Bachelor of Science in Exercise Science Kinesiology and doing 3 years of research on radiation and cancer at the University of Lethbridge. Welcome back to BCN.
Thanks for having me.
So Dr. Koganow, let's talk about how you really deal and handle patients who have cancer.
Yeah.
There must be a lot of compassion involved, isn't there?
Yeah, you have to. It's a very complex time for patients and their families. You have to treat it with care. There's a lot of confusion that's going on. Patients need advice and they need time to sit down with me and also their oncologist. It doesn't happen overnight. You have to take the time to answer a lot of the questions that they have, because they do have a lot of questions.
I have friends who dealt with prostate cancer, and the urologist they had, the specialist said, "Oh, just go with it. You know, you 80% chance you got prostate cancer, just go deal with it." No bedside manner.
Right.
And that's difficult. Some people say, well, that's good because you know where this guy's coming from, he's a straight shooter. But on the other hand, there has to be a little more compassion, wouldn't you think?
Yeah, I love doing naturopathic medicine and especially treating cancer, because I have a lot of time to sit down with patients. And a lot of times it takes a little bit for them to warm up to asking questions. Sometimes they come in with lists of questions, and I'm more than happy to answer them, because it's a scary time and you want to have proper direction.
Now, you deal with both conventional and natural methods. Are they both safe when it comes to chemo and radiation?
No, there is contraindications. You have to be careful when you're dealing with natural therapies, because they are powerful and they are strong, and they can contraindicate with conventional therapies like chemotherapy, radiation, and even surgery. So it's best to speak with your medical doctor as well as your naturopathic doctor when it comes to that.
So sometimes conventional methods work, other times the naturopathic route is more popular or more successful. How do you help patients decide which road to go down?
Well, I'm an integrative doctor, so I actually prefer utilizing both conventional and alternative medicine together. I like to utilize the research that exists out there supporting both uses at the same time. I think that sometimes it's important to look at the research when it comes to these therapies, because there's a lot of benefit in both worlds.
Now, you like to use a lot of natural treatments when it comes to treating patients with cancer. Tell me about some of those options available.
Natural treatments. So there's oral supplementation treatments, as well as injection treatments, as well as IV, intravenous treatments. Oral treatments we can employ in a wide variety of cancers, but certain cancers we can't. For example, patients with esophageal cancer or digestive tract cancers, sometimes they won't be able to absorb or even digest the things that we want to give them. So we can employ injection therapies or IV intravenous therapies. They tend to be slightly stronger and more efficacious anyway. And then that way it bypasses their entire digestive tract.
That's actually how my father died, was esophageal cancer. He had a huge tumor in his esophagus. He couldn't swallow food anymore and basically starved to death.
Oh.
They even brought in they even brought in a surgeon from Germany to install a metal stent to help open up his passageway so he could swallow food.
Yeah.
But the tumor was so powerful that it snapped the metal stent that was inside of him.
Yeah, we can also employ, through intravenous methods, nutrition as well. So beyond just cancer therapies, we can also help to support vitality in those patients too.
So how about antioxidants? Do they really help in the fight against cancer? And maybe when people also have cancer?
Yeah,
are they beneficial?
Antioxidants, there's huge pros to having antioxidants, but there's also contraindications to having antioxidants. So when someone's doing, say for example, chemotherapy or radiation therapy, those are oxidative treatments. It's by and large contraindicated to use antioxidant therapies during that time. Antioxidants as a whole, by and large, are very supportive for treating cancer and helping cancer, but certain times you can't use them and they are contraindicated.
So what are some of the more powerful oral supplements that we can take?
So one of the best researched one is curcumin, which is turmeric. Now there's certain derivatives of it. One is called Meriva, the other is called Theracumin, another is called BCM95. They're typically better absorbed. They're actually some of the best absorbed turmerics out there, or curcumins out there. That's actually one of my favorites just because of the base of research. There's a lot of other things. There's EGCG, there's indole-3-carbinol, there's grapeseed extract. There's many different oral supplements that we can apply to different types of cancers. You don't want to just go out and grab a bunch of supplements. It's best to talk to somebody who's professionally trained to give you those supplements in cancer and make sure that they're not contraindicated in your conventional therapies.
Some people are looking at going to Mexico for some of their treatments. What are the pros and cons of that, outside of the drug cartels and the gang violence that's taking place?
Right. Yeah, I have some concerns with my patients going down to Mexico. One is that the majority of the conventional therapies and alternative therapies that they're looking to get down there are quite easily accessible here anyway. Our regulations are very strict, and I'm confident in our regulations as both conventional and naturopathic doctors here. I've had a few cases that bring a little concern in terms of dosing when it comes to treatment down there. So I just really advise my patients to look into their options up here first and really look into the quality of therapy that they get down in Mexico.
Now, you talked a bit earlier about diet.
Yeah.
Now, are certain foods available that can help maybe slow down the cancer spreading within our body, or maybe a tumor growing within our body?
There's a lot of evidence and research on diet and cancer. I try not to overcomplicate it with my patients. By and large, you want to eat a lot of fruit, a lot of vegetables. You want to decrease saturated and trans fats from your diet. But
It's a lot of fast foods.
exactly. Anything that's refined is really important to eliminate.
Refined sugars, right? So the
That's
pops,
right.
the sodas that are out there.
Yeah, so refined sugar, in general, we don't want to be afraid of sugar because it's a blanket term, right? There's a lot of sugar in fruit and sugar in vegetables, sugar in a lot of different things.
Well, the fruit drinks too that we give our kids a lot of times, right, for their
Yeah,
lunches.
but it's refined. Refined sugars is what we need to be careful of. And there's thousands of studies out there that will show that diets that are high in refined sugars or even high in saturated fats lead to an increased risk of cancer.
So does the tumor actually feed off of the refined sugar? How does that work within our bodies?
It's a little bit more complicated than that, but it can increase different tumor markers, and it leads to either more aggressive, potentially aggressive cancer, or it can lead to cancer. There's many carcinogens in food that we can eat. Even just burnt food is somewhat of a carcinogen. So we have to be careful when it comes to diet, but you can't be overly cautious of eating, especially when you have cancer, because food is life, and you have to make sure that you're eating when you have cancer because it is a metabolic disease.
And our body needs the fuel, right?
Your body needs the fuel.
To fight that cancer.
Yeah. You're burning a lot more sugar. Your liver is burning, going through a lot more sugar when you have cancer. So a lot of times patients will become cahexic. Basically, their metabolism is on overdrive, and they have to eat. So a lot of patients, they have to have a high glycemic index diet in order to sustain their weight and make it through chemo or make it through radiation. And they shouldn't feel bad about that. But on the other hand, you want to be careful with it to a certain extent and not overdo it, because we know that the research says high sugar diets aren't necessarily good for you when you have cancer.
How about foods that could potentially prevent the risk of breast cancer?
Yeah, so there's actually a large study recently done in 2018, actually on a very simple diet that a lot of people are familiar with called the Mediterranean diet. It's a diet high in...
I'm very familiar with it.
Yeah,
Lots of fish.
That's right. High in fish, high in fruit and vegetables, and it actually shows a reduction of breast cancer with that diet, a reduced risk of breast cancer with that diet. Food, especially with specific types of cancers, is very important.
Now, how about for men when it comes to prostate cancer?
Yeah.
What kinds of food should we avoid? What do you encourage us to eat?
So definitely, again, avoiding, with both breast and prostate cancer, trying to avoid red meats, those that are high in saturated fats, are really important. When it comes to prostate cancer specifically, there's actually research to indicate that certain specific phytochemicals in plants, so especially like green leafy vegetables and blueberries, they're full of antioxidants, and they can actually really help reduce your risk of prostate cancer.
I've heard as well with pomegranate juice and blueberries, high in antioxidants, which are
That's
good for
right.
men too, right?
Exactly. Yes.
That's wonderful. How about when it comes to colon cancer? Any dietary recommendations or maybe restrictions?
Yeah, the difficulty with colon cancer is a lot of patients with colon cancer have difficulty digesting their nutrition. So it's recommended that you eat small, frequent meals throughout the day. Also,
Now, when you say frequent, I know some people have
Yeah.
6 meals a day,
Yeah.
small meals a day. Would
Yeah.
you recommend we go that high, or
yes,
3 enough?
absolutely. No,
Really?
no, you want more than 3. You want, especially for patients with colon cancer, you want to be eating small, frequent meals throughout the day. So 6, 8. What you don't want to do is stress the digestive tract. You also want to try and have things that are liquid. So smoothies, for example. You can put different protein powders in there. Protein will slow the absorption of any sugar in the fruit or vegetables that you blend up. But it just makes it a lot easier for those patients to digest food and absorb nutrients.
Now, can you really explain how sugar and insulin levels really impact our cancer?
Well, sugar specifically.
We talked about the refined sugar earlier.
Yeah, I mean, countless studies show that sugar and that cancer is a metabolic disorder. To me, the research is very clear that sugar, especially refined sugar, will increase your risk of cancer. Definitely. In terms of insulin-like growth factor, it will increase specific tumor markers that will potentially make cancer more aggressive. Limiting the amount of refined sugar, to me, is a very beneficial thing to do when it comes to cancer treatment, pending your overall nutritional status is good, and you don't need extra caloric intake in those patients.
So, Dr. Koganow, let me ask you, how important is it to really maintain a healthy weight?
Yes, that again has been researched tremendously. The research pretty well proves, and I'm talking thousands and thousands of patient studies. Like, these are big populations of patients being researched, that there's a direct correlation between weight loss and increased survival rates in cancer. The higher the weight you are, the worse insulin resistance you have or metabolic disease you have. It's pretty clear you want to exercise and be healthy overall, as well as when you have cancer.
So maybe staying away from red meat and as well maybe the Mediterranean diet, some more fish
That's
oils
right.
in your diet.
Yeah.
What else outside of the fruits and vegetables would you recommend?
Well, there was a really good study a few years ago on breast cancer and exercise. And now exercise was defined in this study by walking 3 times a week. A brisk walk 3 times a week.
Like a half an hour walk?
Half an hour walk, brisk, you know, so not.
So the heart
not
rate
super
increases?
The study showed that patients, women, it was a study on women in breast cancer, women that had exercised and stopped exercising when they got diagnosed had a 50% increased risk of death.
Wow.
Those that started exercising that hadn't had a 50% increased survival rate. So what we know is that exercise is very beneficial in cancer. It in every way, shape, and form. Yeah.
Okay, the exercise, but again, the diet, the Mediterranean diet we said, what other diets really work well? Stay away from the red meat, you said? More white meat, like chicken?
I try not to complicate it. You know, if it runs on the earth, if it grows in a tree or grows in the ground, I say you can eat it. Otherwise, don't eat it. To me, it's one of those things that often gets overcomplicated. I have patients that are starving themselves for no reason at all, and that they become afraid of food. You shouldn't be afraid of food when you have cancer.
Well, that's a whole other issue. That's bulimia and maybe anorexia.
Well, yeah, and it's also just a big fear that if they have too much sugar, even in the form of fruit or vegetables, that it's going to feed their cancer to the point where it's going to make it worse and worse and worse. And that's not the point. The point is to limit the refined carbohydrates. So there's many different diets that can do that. Some people will go to extreme and go to a full ketogenic diet. I don't think it's fully necessary for patients to do that. I think if they eat a healthful diet overall, they'll be fine. As you know, as patients need good nutritional status to go through chemotherapy and radiation therapy and even recover from things like that or recover from surgery, they shouldn't be too worried about their diet. They have enough on their plate.
So we talked about diet and exercise. What about stress? How much does that really impact your health and potentially cause cancer?
Yeah, to the extent we don't fully know right now, but certainly stress can cause a lot of chemical changes in our body. Stress has been linked to different cancers, absolutely. It can cause physiological changes like gastroesophageal reflux disorder, which will increase your risk over time of esophageal cancer. It creates digestive tract issues, so shuts off your digestive tract, and can be potentially detrimental to patients. So I think that stress, as in general, is a very common thing in our society today. And it needs to be managed better, and certainly can be linked to different cancers.
Dr. Clayton Koganow, naturopathic doctor in Lethbridge with Meridian Integrated Health and Wellness Center. Thanks so much for joining me here today on Bridge City News.
Thanks for having me.
On behalf of all of us here at BCN, I'm Hal Roberts. God bless, eat well, and have a great night.